My name is Stephanie MacDonald, and I am a sport and exercise medicine physician. I graduated from Penfield High School, and then, like I said, I went on to play lacrosse at St. Bonaventure University, where I majored in biology. And in college, that was actually where I decided I wanted to go into medicine. I sustained a sports injury playing lacrosse and had surgery, and then decided that I was really interested in sports medicine and orthopedics. So I've kind of been through a lot of the things that my patients have been through, so it really helps to be able to connect to them on that level as well. I did my residency in family medicine, so I'm what's considered a primary care trained sports medicine physician. So I'm not a surgeon, but I'm able to treat all different types of acute and chronic musculoskeletal conditions. And I think that my primary care training has also allowed me to take an overall approach to looking at health and the person as a whole and not just an individual body part or injury. My special interests in orthopedics are caring for any active individual. I always like to say that anyone who can move their body is an athlete. So even though I do a lot of sports medicine and taking care of athletes who play organized sports, I also see people of all ages and abilities who just want to become more active, work through different pains that they have, and talk about ways to exercise and just be healthier in general. I think for me the most important thing is forming relationships with patients, and I also think my background in primary care has shown me that long-term relationships and building a strong foundation with a patient is really important in terms of taking care of them. So I would tell people not to be worried about coming to the office. I'm always really excited to meet people and to find out what their goals are and where they're coming from before we even start to talk about why they're there and their pain. My patients mean everything to me, and that's why I do what I do. It brings me so much joy to see them every few months or every year and see what progress they're making in improving their quality of lives based on the work that we do together.